Hello, and welcome to this presentation on understanding the healthcare and housing leverages for the Delaware Continuum of Care's new project funding opportunity. Before watching this presentation, you should carefully read the materials released by the Delaware CoC regarding CoC new project funding to ensure you are familiar with the general terms and project types which will be discussed. The information presented may not be useful if you have not yet read the CoC's new project solicitation materials. Let's begin by reviewing some background information regarding the housing and healthcare leverages. As part of the National CoC Program competition, CoCs submit an application that is scored by HUD. The CoC also submits project applications to HUD on behalf of project applicants. One of the areas HUD evaluates CoCs on during the CoC program competition is coordination with housing and healthcare partners. In the FY 2023 CoC program competition, HUD awarded up to 14 points out of 200 to CoCs that submitted new permanent supportive housing, rapid rehousing, or joint component transitional housing and rapid rehousing project applications that included formal commitments for housing and/or healthcare leveraging. Demonstrating a housing leverage that met HUD's requirements was worth 7 points, as was the healthcare leverage. As noted on the prior slide, HUD is looking for CoCs to submit project applications that leverage housing and healthcare resources. As such, the Delaware CoC asks new project applicants to try to identify housing or healthcare leverages for their new project applications. In FY 2023, organizations applying for new project funds from the Delaware CoC were awarded bonus points in the new project application scoring process for submitting an application that included a housing and/or healthcare leverage. A similar approach will be used in FY 2024. As such, new project applications submitted to the Delaware CoC for funding consideration will be more competitive if they include a housing and/or healthcare leverage. The following slides will provide more details about how new project applicants can structure healthcare and/or housing leverages that meet HUD's requirements. We will now spend a little time looking more closely at what it means to leverage healthcare resources for a CoC new project application. To receive full credit for the healthcare resources leverage, CoCs must demonstrate to HUD that they have applied for a permanent supportive housing, rapid rehousing, and/or joint component transitional housing and rapid rehousing project that includes a written commitment from a healthcare organization that falls into one of the following categories. In the case of a substance use treatment or recovery provider, it will provide access to treatment or recovery services for all project participants who qualify and choose those services. Or, if the services are not substance use treatment or recovery related, the value of assistance being provided by the healthcare organization is at least an amount that is equivalent to 25% of the funding being requested for the entire project. So let's review the kinds of healthcare resources that meet HUD's requirements. The following are examples of sources of healthcare resources that HUD has stated can be used as a healthcare leverage in a CoC-funded project. Your project could receive direct contributions from a public or private health insurance provider for the project. A common example of this is the use of Medicaid as the source of the healthcare leverage. Your project could benefit from the provision of healthcare services by a private or public organization tailored to the program participants of the project. In general, healthcare resources could include health, mental health, dental, and/or substance use services. In terms of eligibility, it is important to note the following. Eligibility for the project must comply with HUD program and fair housing requirements. Eligibility for services cannot be restricted by the eligibility requirements of the healthcare service provider and must be available to all participants. This slide shows examples of healthcare leverages from actual projects that have been submitted to HUD. In our first example, a primary healthcare organization committed over $150,000 of in-kind healthcare resources, including both physical healthcare and behavioral healthcare, to a new permanent supportive housing project. The second example is a project in which a substance use treatment program committed $15,000 in outpatient substance use treatment services for any participant in a new permanent supportive housing project who requested the services. The third example is a project in which a behavioral health care organization committed $45,000 to provide behavioral health and/or substance use treatment services to any participant in a new rapid rehousing project who requested services. Let's review some issues to consider when working on a healthcare leverage. First, be aware that the CoC will need a formal written commitment of the healthcare leverage, so be prepared to follow up with the healthcare leveraging partner organization regarding the written commitment. The CoC can provide a template agreement as a starting point if needed. As part of the written commitment, you and/or your healthcare leveraging partner will need to provide a justification for the leverage amount. When working on the justification, keep in mind that HUD specifically states that in-kind resources must be valued at the local rates consistent with the amount paid for services not supported by grant funds. As you work on the written agreement and amounts to be leveraged, be realistic and don't commit to a leverage amount that far exceeds what is required. Additionally, be prepared to provide some specifics regarding the types of healthcare services to be offered or provided. For example, healthcare services may be for physical health, mental health, dental services, substance use treatment or recovery services, and so on. Be prepared to describe what exactly the healthcare partner is providing to the project's participants if the project is funded. Also, be aware that projects that are selected by HUD for funding as part of the FY 2024 CoC competition will likely start in mid to late 2025. So be sure to clarify with your healthcare partner that the leveraged healthcare resources would be expected to be available at project start. Now let's turn our attention to a closer look at what it means to leverage housing resources for a CoC new project application. To receive full credit for the housing resources leverage, CoCs must demonstrate to HUD that they have applied for a permanent supportive housing, rapid rehousing, or joint component transitional housing and rapid rehousing project that utilizes housing subsidies or subsidized housing units not funded through the CoC or ESG programs. New project applicants for permanent supportive housing, rapid rehousing, or the joint component transitional housing and rapid rehousing project types must document the use of leveraged housing resources with letters of commitment or formal contracts or documents. In the case of permanent supportive housing, HUD wants CoCs to demonstrate that applicants have leveraged housing resources for at least 25% of the units included in the project. In the case of rapid rehousing, HUD wants CoCs to demonstrate that applicants will serve at least 25% of project participants with leveraged housing resources. This applies to the rapid rehousing portion of the joint component transitional housing to rapid rehousing projects as well. Let's review the kinds of leveraged housing resources that meet HUD's requirements. Housing resources may come from private organizations, state or local governments, public housing agencies, which could include the use of a set-aside or limited preference, faith-based organizations, and/or federal programs other than the CoC or ESG programs. A couple of examples of leveraging housing resources are as follows. A project could secure a commitment of housing choice vouchers from a local public housing authority in place of or to supplement the use of CoC rental assistance funds. A project could secure a commitment of units at a low-income housing tax credit building that provides subsidized housing. This slide shows examples of housing leverages from actual projects that have been submitted to HUD. The first example is a permanent supportive housing project in which a local government's mental health services office committed $24,000 in human services block grant funds to support 3 units of housing at fair market rent. This was paired with 7 units of new CoC-funded permanent supportive housing for a total of 10 units. The second example is a permanent supportive housing project in which a housing authority committed 12 housing choice vouchers to pair with 12 units of new CoC-funded permanent supportive housing for a total of 24 units. The third example is a rapid rehousing project in which a housing authority committed 8 housing choice vouchers to the project. This was combined with CoC-funded rapid rehousing rental assistance for 22 households to serve a total of 30 households in the project. In each case, the project applicant committed to providing CoC-funded supportive services to all of the project participants, regardless of the source of the housing subsidy. Let's review some issues to consider when working on a housing leverage. First, be aware that the CoC will need a formal written commitment of the housing leverage, so be prepared to follow up with the Housing Leveraging Partner Organization regarding the written commitment. The CoC can provide a template agreement as a starting point if needed. Be prepared to provide specifics regarding the number of units being provided for permanent supportive housing or households to be served for rapid rehousing and the source of the housing resource. Examples of specific housing subsidy programs that might be leveraged include housing choice vouchers, low-income housing tax credit development units, home program funds, a local housing trust fund, and so on. Be prepared to identify a general start date at which the housing resource would become available. Projects that are selected by HUD for FY 2024 CoC funding will likely start in mid to late 2025, and the leveraged housing resources would be expected to be available at project start. Explain to your housing partner that you will need to wait to hear from HUD as to whether this project gets awarded CoC funds, but they would need to be prepared to make the committed housing resources available, if selected, once your agency goes under contract with HUD. Remember to be realistic. Work with your housing partner to determine the number of units and households served that they are able to commit to. Try to meet the 25% threshold set by HUD, but if you cannot, you may still be able to get partial credit through a partial leverage. Some housing leverage is better than none. We've gone through the explanations of the 2 types of leverages, so let's wrap up. A quick tip. As you work on developing your new project application for the CoC, keep in mind the information shared in this presentation. As discussed earlier in the presentation, submitting projects with housing and/or healthcare leverages enhances the CoC's competitiveness for funds from HUD. As such, new projects that offer viable housing or healthcare leveraging are more likely to be selected by the CoC for submission to HUD. If you are wondering how to get started in developing a viable housing or healthcare leverage to include in your new project application for the CoC competition, here are a few ideas. Explore existing informal partnerships you have with healthcare, mental health, or substance use services organizations to determine if informal partnerships can be leveraged into formal written commitments. Engage in conversations with your local public housing authority, local government housing office, or affordable housing developers about the potential of committing units for a new CoC-funded project. Help them understand how this could help their work as well as the wider community. Engage in conversations at the community level about potential partnerships with healthcare or affordable housing partners. You may find others are working on projects that could turn out to be a great leveraging opportunity for each of you. Here are some additional tips for developing a housing or healthcare leverage. If you identify a healthcare organization that is willing to put a commitment in writing, you can start to work with the healthcare organization to develop an estimated dollar amount for that commitment. Work on pulling together an estimate based on the number of participants, the reimbursement rate for the services to be provided, the frequency at which the services will be provided, and any other relevant details. If a substance use treatment or recovery program is willing to commit resources, confirm that any project participant who qualifies and wishes to use the services will be able to access those services, and identify when those services will be available. If a housing provider seems willing to commit in writing to providing housing resources, work with them to identify how many units they could offer, from what funding source, when they could make the units available, and so on. In general, as you discuss details with potential partners, you may conclude that the leverage is not viable after all. Don't be too discouraged. This is useful information and will free you up to explore other options that are more viable. We've reached the end of our presentation on the healthcare and housing leverages for CoC new projects in the Delaware CoC. Thank you for watching. If you have questions about the healthcare and/or housing leverage, please reach out to the CoC for more information by emailing the contact listed in the new project solicitation materials.